We're talking about cancer treatments. And as you know, a lot of patients and chronic patients, they suffer from pain. And with us, we have Dr. Mark Sirgo, who's the CEO of Biodelivery Science. And he's going to talk about the new company that actually can deliver biodelivery science of some of the opiates in order to control pain management. Dr. Sirgo, good morning. Dr. Samadi here.
Good morning, Dr. Samadi. It's a pleasure to be with you.
Thank you for being with us. And I know that you have this great invention, the product called Bonovel. Am I pronouncing it correctly? Which was approved by the FDA. And it's really indicated to maintain treatment of opiate dependence. Can you tell us a little bit about this?
Sure. First of all, the active ingredient in Bonovel is buprenorphine, which is an opioid, but unlike all other opioids, it's actually a what they call a mixed opioid agonist-antagonist, and therefore it has different features than what you would normally see with something like, say, morphine or fentanyl or oxycodone. And by that I mean it doesn't cause the euphoria, has a very low propensity to cause the euphoria that all other opioids typically will cause. And that's what these patients that become addicted to an opioid crave. It's that high feeling, the euphoria that they get when they take these opioids. But with buprenorphine, there's a very low propensity to cause that. But at the same time, it satisfies these patients' cravings for the drug or even heroin that they are addicted to. So you're able to actually wean these patients off of the offending agent, whatever it might be, while you titrate them up on buprenorphine, in this case, our product, as you referred to, as Bonovel.
Of course. This product is now available, right?
Correct. We launched the product not quite a year ago.
And if someone has a problem, and how do they go about doing this? Do they talk to their doctor about this? Where do they get some information about this?
Yes. If they're seeing a doctor routinely, such as a primary care physician, and they, indicate the symptoms that they're having and the problems that they're having, then they can typically refer them to a treatment center. So it's a specialty, if you will, and you have to be DEA qualified to prescribe buprenorphine. So, but there are a number of physicians throughout the country that are doing this, and they just need to get in contact with one in their area.
All right. So is it covered by insurance, or do they have to pay out of pocket?
Well, as long as they have an insurance plan, commercial insurance plan, yes, it is covered, and Medicaid also covers it. It fell under some of the new provisions under the Obamacare Act. So yes, it is covered.
And what's the cure rate, or is this like to get out of any kind of addiction, or is this to just maintain their pain and suffering?
Well, many of these patients do legitimately have chronic pain.
Right.
80% of the people in treatment with Bonovel or related products, 80% of them actually have become addicted to a prescription opioid. The other 20% became addicted to heroin. So many of those people that got addicted to the prescription opioid do, in fact, have chronic pain. So once they go through treatment with buprenorphine, because it is an opioid, it does have a positive impact on pain as well. So you get both benefits for those people who legitimately are suffering from chronic pain, but unfortunately became addicted to whatever the opioid was that they were taking for their chronic pain.
All right. So if someone wants to get more information about this, is there a website or any place they can go to read more about this? Because I think it's a fascinating topic. A lot of people may be getting addicted to this even after they've been in the hospital for a long time. They got a lot of medications, that's Percocet and other things that may have, or opioids that have addicted them, and they need to control their pain. Where is a good website to read more about your work and the company and everything else?
Sure. Well, they can go to our website, which I think is a good place to start, which is www.bdsi.com. So B as in boy, D as in David, S as in Sam, I as in Ida.com. There's also a program called InReach. It's another online program that we actually sponsor. It doesn't talk about our product specifically, but gives potential patients an opportunity to learn more about the disease, condition, treatments available, where they can seek such treatment, and so on.
Great. Thank you very much, Dr. Sirgo.